Hi, this is Dr. Steve Mora. I'm an orthopedic surgeon in Orange County. Recently I've been asked by some of my sports medicine colleagues in the area how I've been utilizing the needle scope in my practice. Where does it fit? How best does it fit? How best can it be used to help our patients? So I've been using it for a few months now. I've actually been using this specific brand. It's called the IntraVu. The IntraVu is a needle scope that is the smallest in the industry right now. It's 1.4 millimeters, the highest resolution. That's what I like about it. I like the fact that it has high resolution. So what do I use it for? I think the best use in sports medicine, or what I think is the best use, is there's actually a few. The first one that I find useful is for patients that have had a meniscus repair or who've had microfracture treatment. Maybe they're at the point where they should be getting better. They may be ready to be cleared for sports, but maybe you feel that maybe they're not quite there yet, or perhaps you're questioning whether the lesions have healed, or perhaps the patient is having some symptoms that are suggestive of some problems or not healing. So those patients can benefit from this, because before they're cleared to do sports, or before you tell them that you need another MRI, before you scare them with the possibility of more surgery, you can tell them that you have an instrument that's essentially just a big needle with a little camera at the tip, and that you can put it into their knee with a little bit of local anesthesia. I usually use about 30 cc's of local anesthesia. I don't need any staff, except maybe my MA, just to hold the cable pretty much so it doesn't move around. I prefer to do it in my procedure room or my surgery center, only because it's easier. My supplies are there. And I can put it in the knee, take a look and see if the lesion has healed or not, and then I can better educate the patient regarding the problem. So once again, post meniscus repair, post microfracture, post MACI surgery, articular cartilage or chondrocyte transplantation. So I think those are really good reasons, and probably the most beneficial, and they make sense, or it makes sense to use a needle scope in those situations. Other reasons that I find it useful for, the obvious is a patient that can't have an MRI. They have maybe a defibrillator and they can't have an MRI, and they have meniscus or cartilage type of symptoms, and you just want to double check, put it in there, take a look. There's not much else you can do other than a CT arthrogram, which I really don't find that useful. So that's the other subset of patients that it's good for. Another group of patients, I think this is a little bit more esoteric. It's for people that do more cartilage resurfacing, such as people that do the MACI procedure or OATS and procedures as such. Let's just say you have a patient that's coming in from out of town. They come in, they have an MRI. The MRI shows chondral defect, maybe a grade 3, a grade 4 chondral defect, and they know they're going to need some sort of cartilage procedure. They've been told that maybe they just need a debridement, or maybe microfracture, or maybe something more exotic. So those patients can benefit from this, because you can put it into their knee. You already know where the lesion is at, because you have an MRI that shows an abnormality of the cartilage. You look at it, and if it looks like it's an obvious, high-grade delamination, then you can tell the patient, you're most likely going to need a cartilage resurfacing procedure, such as a MACI or an OATS. And with that information, the patient will know that they will have a long period of recovery, long period of crutches, recovery, physical therapy, non-weight bearing, etc. Now, if it truly is a lesion that's just a little fibrillation, grade 3 type, and you feel comfortable doing a debridement, then you'll know that you'll be able to tell the patient with accuracy and confidence that all they need is a debridement. So once again, patient that comes in, sports injury, positive MRI for cartilage injury, grade 3, grade 4, hard to tell. The patient wants to have more information. They like to know what the post-operative recovery is going to be like. Needle arthroscopy, once again, procedure room, 30 cc's of lidocaine. You don't need any assistance. Put it in there, confirm what grade the lesion is, and then you can provide the patient the proper information, so that when they schedule their surgery, they know how long they're going to be off for. I think that's actually very useful information for everybody, because then the surgeon can prepare for the surgery as well. And then the last reason that I think this is useful for is a patient that has a positive MRI for meniscus tear. It's an athlete, whether they're a high-level athlete, or a weekend warrior, but they want to continue doing their sporting activities, and they're not sure whether they really want to proceed with meniscus surgery. They're maybe they're worried about the symptoms, and they're wondering if they're causing more damage to the joint. The typical question is, Doc, am I causing damage to the joint? I know I have a meniscus tear. And let's just say they don't have gross symptoms of locking. It's a hard question to answer. And it's one of those questions that sometimes we have a hard time answering it with having comfort in our heart saying, no, you're not going to damage it. Because do we really know they're not going to damage it? It's hard to know. So the option can be, let me put the needle scope in you. It takes 15 minutes. We can do it later today, tomorrow, whenever, and let me look at it. You don't need general anesthesia. It's a 15-minute procedure. I'll look, and if it looks like it's an ugly meniscus tear that is flaps already eroding the cartilage, I'll be able to tell you with much more accuracy and confidence, and then everybody will be happy, and in the end, you will not have done any harm. So once again, that's the patient that has a meniscus tear. They're not certain whether they want to have surgery or not, but they also don't want to damage their joint. Needle arthroscopy. So once again, this is the IntraVu. I've used this one more than any other company. There's a couple on the market, but like I said, this is a nice thin needle scope, one hand type of control, and it comes with this monitor here. You put in a USB storage drive, and so you can save the pictures. And if you look at that screen, I mean, look at that. You can see the absolute great resolution. You know, there's my fingerprints, and very easy to use, and great company support as well, which is something that I really like as well. Once again, IntraVu Needle Arthroscopy. I'm Dr. Steve Mora. If you have any questions about it, please reach out. I'll be more than happy to answer. Thank you.